So just to clarify, are you suggesting that putting the state into a lockdown is the wrong call? If you were Premier, you would have decided to let things run, perhaps just introduce a few restrictions and not go for the full lockdown, which, as we know, is trying to help the tracers really get on top of that contact tracing process?
What I'm saying is this Queensland Health and Queensland State Labor Government have to improve their tracing and testing. We were told 11 days ago by the Chief Health Officer that things were running very smoothly, had it all under control, and yet here we are 11 days later and COVID's been allowed to get out into the community. We've had reports this morning of another 8 cases that have been tested and found positive yesterday. So why is it, if the contact tracing and testing was working, have these cases been allowed to get out into the community? That's what I'm asking, because we can't continue to lock down. We spent a lot of money last year. The federal government has invested $250 billion into keeping people safe, and a lot of that money went into state governments. It's state governments to ensure that their systems would be up to speed. We were told those systems are up to speed just 11 days ago, and now we've had to lock down again.
You mentioned it's disappointing to learn that rules haven't been in place before now to ensure that only vaccinated health workers can treat COVID patients. That's something that the Queensland Government is implementing from tomorrow. Does National Cabinet need to urgently meet on that front and ensure that that's a national guideline? It seems like common sense.
Well, it would seem like common sense. I'm not sure National Cabinet needs to meet to make decisions like that, which really could be made at the ground level. But it's not just the fact that these people weren't vaccinated. It was the fact that if you're working with people who have a COVID or could have COVID, surely you would say as a part of your job description, look, we're going to restrict your radius of travel to within 5 kilometres or 10 kilometres where you live, so that, this potential infection doesn't spread any further than it has to. That's the thing. I mean, why they were allowed to go to Byron Bay, after dealing with potential COVID patients I find quite surprising.
Just finally, we are awaiting this afternoon the new female-friendly cabinet to be sworn in. Are you confident that will act as a sort of circuit breaker for your government when it's dealing with some of these issues surrounding women that we've heard so much about in recent weeks?
Well, I hope so. But look, it doesn't change underlying principles of always treat everyone with respect. I would have liked to have thought that with or without titles, we all treat each other with respect, and that we treat women like we treat ourselves. So, look, I hope it is a circuit breaker, because I'd like to get on with, getting out of COVID, moving forward with an economic recovery that involves building a lot of infrastructure and getting people back to work. And some of these things, really, I'm surprised we've had to go there. People should know better. We do have to treat women with the utmost respect. But, if you needed to be sort of, if you don't know that before you get into Parliament, well, you probably shouldn't be in Parliament.